It's Black Friday and I've got something totally amazeballs for you today, and only today. If you're looking to make 2018 the year that you fix more feet like never before, then this video is for you. I'm about to let you know how you can put a really cool leading edge tool in your toolkit so that you can totally crush it in 2018. G'day, I'm Ted Jedinak, International Educator in Manual Therapies. I help health practitioners take their skills and expertise to the next level so that they can help more people like never before. Throughout my 30-year career as a health practitioner, I've been on a mission to get outstanding results in my clinic because there's nothing more fulfilling than fixing feet and having a positive impact on patients' lives. For over 20 years, I've been teaching, training, and mentoring podiatrists, physios, chiros, osteopaths, doctors, surgeons, and other physical therapists in the practical skills that get results at the coalface of their clinics. It's been a total blast to travel the world and work with dedicated health practitioners who put their clinical outcomes in the heart of everything they do. So, here's the $1 million question that so many health practitioners worry about. In fact, wherever I go around the globe, it's the same for every dedicated practitioner. What do you do when an MSK condition like plantar heel pain or Achilles tendinopathies or shin splints don't fully resolve? You've tried everything you know, and still, there are always those patients who kind of get better, but not best. Do you tell the patient to persist and hope for the best? Do you refer them out to another practitioner? Do you feel like you've failed the patient in some way? I've certainly felt that way. And so it led me on a mission to fill in the missing pieces in my education. I just didn't get taught at university all the things that I needed to know to get the best results for my MSK patients. At the coalface of your clinic, you're the one who either succeeds or fails in the eyes of your patients. And when patients are investing their time and hard-earned money into your service, you're under a lot of pressure to deliver. There's nothing worse than being at a loss as to what to do for a patient. And it's so difficult to say to a patient, I'm sorry, there's nothing else I can do for you. On the flip side, it's so fulfilling to treat those patients who've been told that there's nothing more that can be done for them and actually fixing them. I remember a patient, Carolyn. This is a corporate executive woman who didn't suffer fools lightly. She was forthright, intense. You wouldn't want to get on the wrong side of her. Carolyn presented to me with the typical plantar heel pain. She was adamant that she didn't want orthotic therapy. She didn't want to stop wearing high heels for work. It was really important to her to present herself in a certain way. No worries, I thought. With hands-on manual therapy in my toolkit, I was confident about fixing Carolyn. So off we went. 6 weeks later, Carolyn's sitting in my consulting room giving me the death stare. Unfortunately, she was not much better off than when we started. Oh dear. See, along the way, I tried every trick that I knew, including referrals for dry needling and physiotherapy. Carolyn felt some improvement, but overall she wasn't happy. It was at this moment that I was, feeling pretty bloody useless. Fortuitously, I just completed a training with a physical therapist who specialised in tool-assisted fascial release. Now, during this training, Carolyn's face kept popping up in my mind's eye, and I couldn't wait to offer her a new treatment option. I wasn't sure that Carolyn would persist with me, but heck, what did I have to lose? I hate failure. Might be a bit of an ego thing, but that's how I am. In just 3 weeks, using this new fascial tool, Carolyn's world turned around, and so did mine. This tool helped me assess and treat Carolyn's plantar heel pain in a way that I'd never done before. It opened a whole new door. And I've got to say that initially, I was a bit worried about this tool because I didn't know any of my colleagues or peers who were using it. The only practitioners that I knew of were kind of a bit left field, and I was thinking, geez, if this tool can be so transformational, why isn't everyone using it? But then I started looking into the evidence base, and now another new world opened up. Manual therapists, physiotherapy, osteopathy, the Bodywork Journal, and there was a ton of research going on that I had no idea about, and some pretty high-level stuff. When I spoke to one of the most pointy-headed academic researchers I knew, Simon Bartold, now his wife happens to be a remedial therapist, he too acknowledged the research depth in manual therapies. Now, having used the TAM tool for myself for now over 6 years and taught hundreds of practitioners how to use it, look, I'd be saying that it's a tool that I wouldn't work without. It helps existing treatments like orthotic therapy, physiotherapy, exercise rehab. Another great thing about TAM is that you don't need previous manual therapy training to use it. You can be a complete novice with no hands-on training and quickly master this incredibly effective tool. Because TAM has been so popular and so useful, we've now put the TAM training online. As far as I know, it's the first tool-assisted fascial release online training in the world. It's the training I wish I had access to much earlier in my career. The online TAM course develops your manual therapies skill set so you can get the clinical outcomes that may have previously eluded you or that you had to refer out to another health practitioner. Specifically, this online training gives you an incredibly useful option for those MSK patients that get better but not best. Cases like Achilles tendinopathy or medial tibial stress syndrome or plantar heel pains. Even knee, hamstring and hip problems can be within your reach. With TAM in your toolkit, you'll be the key practitioner managing your patients. You'll become the light, like a beacon of light in your community by helping people like never before. But a quick comment about what TAM doesn't help. Now, TAM is not suitable for hypermobile patients, patients with tarsal coalitions, bony blocks, osteochondral lesions, neurological etiologies, just to name a few. We go through the full list of contraindications in your tutorials. It's important to understand that being skilled in TAM helps you help your aged granny to the world's elite athletes and everyone in between. It can really be a life-changing skill set. And that's certainly what so many of my students have told me. The TAM online training is divided up into easy-to-digest modules. Now, let me walk you through those modules now. Module 1, Clinical Theory, is based on the science and the treatment models, precautions, and the documentation of TAM services. Module 2, this is the physiology overview that dives into the physiology of fascia, the biomechanics, the treatment objectives, contraindications, and the evidence and references so you can be confident your TAM services are evidence-based. Module 3 dives into the 6 release techniques that you'll use in your clinics in a clear, practical manner. Module 4 is on MSK conditions, and it provides you with step-by-step assessment and treatment techniques for plantar heel pains, Achilles tendinopathies, tib post-stress syndromes, tib ant syndromes, hamstrings, hallux abductor valgus, hammer toes. The TAM online course is structured in clear, logical sections of welcome and orientation, clinical theory, physiological principles, TAM techniques, and MSK conditions. You'll find the clarity of the lessons a breeze to navigate. This modern age of the internet means we can provide training resources like videos, audios, PDF downloads for you to access when and where it suits you. You'll have lifetime access, including all updates that inevitably happen as research progresses. This means you can also review lessons and extract new distinctions. It's kind of like seeing new things in a movie that you're seeing for the second time. Each TAM technique has its own benchmarks and video for you to check your skills against. But if you're still not completely sure that you have the techniques nailed, film yourself, send it back to us for personal feedback. And look, if you don't feel that you've gotten great value and are better skilled to help more people, then let us know and we'll refund you. You just have to send us your completed worksheets and video clips of the techniques that you've learnt. And you'll have a whole year to test this all out, so there's no pressure on you. The training also qualifies for CPD points. In Australia, that's 6 Category 2 points according to AHPRA's guidelines. The retail fee for the new online TAM training, which includes the tutorials, the technique skill training, and the exclusive personal access for feedback, is $697. Today, Black Friday, we've an exclusive offer for the new TAM online course. You can save $300 by using the coupon code Black Friday, making the fee just $397. This offer expires midnight Friday, November 24, 2017. All you have to do to get started is click the Buy Now button on this page, and you'll automatically be directed to the payment page. It's that easy. Once your payment has been completed, the hosting platform will automatically send you your login details so you can get started immediately. And you'll have lifetime access to the online training and all updates that happen in the future. Please hurry, because this offer is only available until midnight, Friday, November 24. After midnight, the retail price of $697 returns, so jump on board now. Remember, you're only one click away from having an extraordinary 2018 by helping more people like never before.